Sir, you are not visible.
Yeah. Am I audible?
Yes, sir.
Okay. Okay. So hello all and welcome to this session. And welcome to this session on the anatomy subject. I'm Dr. Ankit, your anatomy faculty in the Auricle platform over here. And welcome to this 90 days foundational live classes for university exams. The topic that we are going to discuss today is about the general anatomy, right? So the topic today is about the general anatomy over here. We all start with anatomy by understanding the general anatomy. General anatomy includes all the basic nomenclatures. So it is like, before you make a sentence, you learn ABCD in English. So it is like that. So you understand the basic terminologies of the body in general anatomy and how to name every structure. Then you proceed further. So today's session is on the general anatomy. It is going to be beneficial for university exams as well as next exam also. Below in the bottom line, we can use this code also. The code over here is Dr. Ankit 20. So getting any other subscriptions, discount on our subscriptions. Okay, fair enough. So let's move to the next slide. So yeah, the topics that we are going to discuss today are the ones which are listed over here on your screen. So what are the topics? One topic that we are going to cover is about the typical spinal nerve. And the beauty of Oracle is that we give you in a question format so that you understand that, okay, apart from understanding the concept, we also know that this topic is relevant in which sort of question. For example, a typical spinal nerve can come as a long question, long essay type question, distribution, anatomy, all that. Then after discussing the spinal nerve or one of the topics, the next topic that we are going to cover are in the short essay questions, which are about the, again, the epiphysis, that is a part of the bone topic, and about the synovial joint, or particularly can deal with the joint per se. And interosseous membrane also comes as a different question, but it is a part of joint only, fibrous joint. Then apart from this, again, we are going to discuss some other topics which are a part of the one that we have already seen. So the main things that we are going to discuss today are regarding the general anatomy of the bones, general anatomy of the joints, and general anatomy of the spinal nerve. And in these three topics, you are going to see majority of the questions that are asked in your university exams, as well as if you give your next exams or NEET or whatever it is, the PG exams, right? Okay, so the slides over here are why to choose Oracle. All these slides, you can just have a look at them. We'll discuss them in the later part of our discussion also, or after we finish discussing the topics. We'll discuss them in detail also, that these are the benefits of Oracle. Just to name, we can see recorded live classes, we have practical sessions, we have exam module sort of discussion, and we have hard copy book sets. So these are the five main pillars of the Oracle app over here, Oracle whole platform on which the whole foundation of a medical education is based on. Benefits of recorded classes, live classes, express exam module, doubt clearing, something of really important over here. We can call it as a soft power of education, the doubt clearing session. Normally people ignore it, but yeah, it is also very important. Then we have a hard copy note set, we have a question bank, and we have practical sessions like these. Okay, yeah, just to show you this slide, you can take a screenshot also of this particular slide. And you can see at the top, we have around 4 subscription plans. The benefits or the points in each subscription plan is being uh, denoted over here, and with a definite time period of starting from 3 months to 6 months to 12 months to 4 years. So we have from short-term plan to medium-term plan to a long-term plan. We have different subscription plans. So don't go with only the image over here. You can use this code also below. So you can get a relevant discount on subscriptions, right? So just take a screenshot of this particular slide. We have from 3 months to 6 to 12 months to up to 4 years of subscription plans are over here. Okay. So yeah, this was the introduction. We'll come back to it at the end of the session after we have discussed these topics in our general anatomy. To start with, let's start with the bones when we come to the joints and the nerves per se. Okay. So just moving on to the next one over here. So I hope you can see the slide over here. We are discussing the epiphysis thing over here. Okay. So what is epiphysis is a question, and what are the types of epiphysis? So both of them are the question. What is epiphysis and what are the types of epiphysis? Just a second. Let me use a pen over here. Right. So let us discuss this topic. It's quite important, quite basic, but yeah, one must know about this. So if you look at a long bone, yeah, long bone, for example, bone of the arm, bone of the forearm, bone of your lower limb like femur in the thigh, or we have tibia fibula in the leg. So typical long bone will have a basic majority part of the bone is this shaft, right? This shaft over here, cylindrical shaft. And then the bone will have two ends. Bone will have two ends, right? Why it will have, why we are discussing the end side as separate thing than the shaft? The reason is very straightforward, simple. That the ends over here will be making a joint with another end of another bone. Could be a long bone, could not be a long bone. So therefore the ends will be anatomically and developmentally slightly different. And therefore these ends are the one which are known as epiphysis. Epiphysis. Okay. The shaft over here is known as a diaphysis. Is known as what? Diaphysis. And as we all know, when a child is born, then the size of the child is around 40-45 centimeters, something like that. Then obviously we grow, we have 2 foot, 3 foot, 4 foot, 5 foot, 6 foot, and subsequently the height increases. So obviously when a child is born, then the size of the bone is different at that time. Then as soon as the age progresses, the bone length will also increase. So how will it increase if the complete bone is found at one go only? Therefore, actually, what actually happens is that between the epiphysis and diaphysis over here, we have some part of the bone which is not a bone to begin with. So to begin with, the area between epiphysis and diaphysis is basically you have a cartilage over here, which is basically hyaline cartilage. And therefore, this area over here, which is also known as epiphyseal plate, but in simpler terms, we can say that area between epiphysis and diaphysis is known as metaphysis. So you should know the basic terminology that it is not just epiphysis. Because the question is coming like epiphysis, but you should have a basic knowledge. Okay, if someone is asking epiphysis, it is my responsibility to know, are there any other thing which are associated with this term? So yes, there are metaphysis and diaphysis as well. Simple as that. So now coming to the question, then what is an epiphysis and what are the types of epiphysis? Simple as that. So ends of the bone, let me just mark the ends or end tips of a bone which ossify from secondary center are called epiphysis. As we have seen that these are the ends, E for end and E for epiphysis. So you can remember in that manner also that E for ends and E for epiphysis, as simple as that. Now, how? What is the classification? So is there any classification? Yes, there is classification. Okay, let us see. So according to the number of epiphysis, they are numbered differently, right? So according to number is we can have a simple epiphysis, we can have a compound epiphysis. What does it tell us? Very straightforward, simple. Let us see what it means actually. Simple epiphysis, ends of a long bones develop from many epiphyses which fuse independently with shaft. So there are multiple epiphyses which are fusing independently with the shaft. With the shaft, they are fusing independently. So the word independently is important over here. In the compound, ends of bone develops from many centers which unite to form a single epiphysis, which in turn fuses with the shaft. So it is very straightforward and simple way to understand. What is that? You have a shaft over here. Suppose this black color is a shaft. There are two bones which are having the shaft over here. Okay. Let's say a bone of the thigh and a bone of the arm, femur and say humerus. Now, both of these bones will have multiple epiphyses. When we say multiple epiphyses, why are we saying multiple epiphyses? The reason is that if you look at a at a long bone, or if you look at epiphysis, you don't only see the joint over there. Apart from joint, there are various other ligaments and muscle tendons attached to it. Therefore, every epiphysis will have different multiple structures, which are named either as tubercles or trochanters or tuberosities. You can name anything. So suppose there are three different structures in one bone. Similarly, there are three different developmental epiphyses in different bones. So there are three types of epiphyses or three names of epiphyses in both of the bones. Now, what happens in bone number first bone over here, that all these three, 1, 2, and 3, they will go and they will talk to the shaft independently. I mean they will fuse to the shaft independently. Okay, then this epiphysis number 1, it came to the shaft at say the age of 16. Epiphysis 2 came to the shaft at say age number 15. Epiphysis 3 fused with the shaft at say age number 14. Just hypothetically, I'm telling. So they are going independently without telling each other. So they are going independently. Now, in the other case, 1, 2, and 3, these three epiphyses, they will first form one complete unit. That unit is known as 1, 2, 3. That has now become a single unit. It will automatically fuse then with the shaft. Simple as that. So this will be a case of humerus over here, or the bone of the arm, and this will be a case of when they are going independently. It is a case of say femur over here. So they are classified as simple and compound epiphyses. Just learn it for the time being. Their applied importance is important when you are doing an age mapping, when you are doing forensic medicine, or in various operations or treatments in orthopedics, right? Then they are used. But yeah, for the first day, for the beginning, at least you should know the difference between simple and compound epiphyses. I hope I'm clear with this point, right? Just to begin with. Now, more important or more famous than this classification of epiphysis is the another classification that is coming over here, from where the majority of your questions will come. That is classification which is based on what function of the epiphysis. First classification was based on what? It was based on the number of epiphyses. Okay, that they are going independently, or they are first fusing as a complete single epiphysis, then they are going to shaft. That was first. Now coming to the based on function epiphysis. Now here these 4, 5 names are important. At least these 4. The compound one, you already have seen what is compound, simple, and compound one. So yeah, you need to know about these 4 epiphyses. Pressure. Now here, see, there are many ways to learn any particular topic in any stream, not just medical, anything. So the moment you are learning anything, see what the name is. Are you able to make out any meaning from that particular name or not? If not, then obviously you have to cram it. If yes, then that cramming or that rote learning becomes very simple. For example, over here in the first example, if I go simple and compound. So simple and compound. Simple means simple. Compound means there are multiple things which are forming one. Similarly, over here you have terms like pressure epiphysis. So something is pressurizing them. The end of the bone is being pressurized. So what pressure can be there? Pressure of the weight could be there. Second type of epiphysis is the traction. Traction means, what is traction? Traction means you are pulling onto something. First was putting pressure. Second was traction. Something is being pulled. Third is atavistic. Atavistic means phylogenetically it is different. It is independent. You see its example. One example you already see is coracoid part of scapula, that you will learn more when you go to the upper limb part, where you will learn, where you will be taught the bones of upper limb, basically the clavicle and the scapula. The fourth over here is known as aberrant. Now, what is the English meaning of aberrant? Aberrant means something which is not normal, which is aberrant, which is abnormal. That is in a different way known as aberrant, right? So these are the 4 classification on function. Last compound we already have seen that we have in some bones these epiphyses, they form compound epiphyses before joining that we have seen already in the previous example. So let us see the example now. Pressure epiphysis. Pressure means some weight is being put onto it. So it is articular. Articular means it is forming a joint with some other bone. epiphysis is forming joint with some other bone. So imagine if a human body over here, suppose this is head and neck, this is the trunk part, okay, this is the lower limbs, these are the lower limbs. So obviously the weight is going in which direction? Weight is going in this direction, right? So the bones, the epiphysis over here, the epiphysis over here, they are being pressured, or the weight, pressure of the weight is falling onto them. They will develop pressure epiphysis. So takes part in they're already written over in the weight transmission, like the head of human. Similarly, upper limb also helps weight transmission. Simple as that. Traction, as I told, that it is being pulled by something. So they are non-articular. What does it mean? See, when something is articular, then obviously it is enclosed by a joint. Then there will be synovial fluid. So therefore, no normal structure can come inside the joint and pull it. Therefore, for epiphysis to be traction, it has to be lying outside the anatomical boundaries of a joint. I hope you're understanding, but I know it's not very straightforward. I will repeat it again. Point over here is that suppose this is, say, one bone over here. Okay, this is one bone over here. Now, imagine I'm giving you an example of pressure epiphysis, weight transmission, right? So there'll be another bone over here. And you can imagine that, okay, there's a joint over here. So this epiphysis, which epiphysis? It is a pressure epiphysis. So the weight is falling in this direction. Another example over here, the same bone I'm trying to show you. Suppose there's the same bone over here. Okay, it's forming a joint over here. And this are the anatomical boundaries of the joint. But now we are dealing with some epiphysis over here. What is happening over here? Some muscle tendon has come and attached over here. So now this epiphysis, just a second. Yeah. So now this epiphysis over here, which is lying outside the joint, will be an example of traction epiphysis. So therefore, it is non-articular. It is outside the anatomical boundaries of the joint, which I have showed with this red color over here. I hope you are getting a point. So provides attachment to one or more tendon which exerts traction epiphysis, example, trochanter femur. So like we have, so I told you their names, trochanter, tuberosity, tubercles, so many names are there. So here in femur case, we have a greater trochanter, we have a lesser trochanter. So if you are smart enough and you are keeping your eyes and mind also open apart from your ears, then you would like to know, okay, that which muscle is attached to the trochanters. Which muscle is attached to trochanters? I'll give you names right now also, but yeah, once you reach the level at where the topic of lower limb is being discussed, they will be taught to you again. But yeah, greater trochanter, we have muscles like gluteus muscles, the muscle of the buttock region, gluteus medius and gluteus minimus. And the lesser trochanter, we have muscles like iliopsoas, iliacus, or psoas major, all these muscles. So I hope you're understanding the meaning of it. Then we have atavistic, which I told you it's phylogenetically independent, as an example I told, in humans have become fused to the bone. While if you look at other animals or other, apart from mammals and birds also, then this is quite part of the scapula. In lower animals, it is a separate bone, but in humans, it is sort of fused. Then aberrant epiphysis, it is not always present. It is something you may see, you may not see, but yeah, this knowledge should be there that yeah, at the head of first metacarpal. What is metacarpal? These are the carpals, and these are the 5 metacarpals. The first metacarpal is the one that is going to the thumb side. So at the head of first metacarpal, you can have a different or aberrant epiphysis. Okay. Now this knowledge is important. Suppose you get an X-ray of the hand of a patient. Then if suppose some bone you're seeing over here in an X-ray, which you have seen, say 5-6 X's before also, and in those 5-6 X's before you were not seeing this aberrant epiphysis, now you are seeing it. If you don't have the knowledge of this aberrant epiphysis, you might label it as a fracture, right? But it is not a fracture. There is no pain history and all. So you know that it is a normal thing. It might not always present. This is the benefit of knowledge. If you're not having this knowledge, you might label it as a fracture. You might even give them some treatment. Therefore, in medical line, the knowledge is so important, right? Because it changes the whole course of the treatment at any level. Fair enough. So yeah, these are the types of epiphysis which you have seen over here. Now we're coming to the bone, simple classification of bones. We will see quickly. Let's see the classification of bones. Then come to the joints part. Though we have just seen epiphysis, diaphysis, metaphysis, there are parts of bone only. Where bone is 1/3 of connective tissue. So I'm going to highlight the important parts over here. We all are learning it from school time that it is a calcium, the mineral phosphates, and all that, which constitute the bone. Therefore, just going, I'm drifting a bit away from the topic of anatomy over here, but yeah, you should know that as age increases, our dietary factor and all, which are not very rich in calcium, if not very rich in calcium, then you should have the patient is complaining of bone pain, joint pain, and then weakness and all. You should get their vitamin D and calcium, serum calcium checked. If found low, then obviously you can start with calcium and vitamin D tablets after discussing with the physician over there. But yeah, serum calcium normally is kept in check because serum calcium has a very thin margin. So if it goes below that threshold, the symptoms and signs will start to appear. So normally it's a vitamin D which has to be kept in check. And normally, since we have entered into this modern times from the last 30-40 years, I would say, because before 30-40 years, people were more on a normal day-to-day life, they were more hardworking because so many of machines were not there. So my point over here is, with this past 30-40 years, we are more indoor working individuals, right? If even if we go out, we are under the shade of our vehicle or public transport or whatever it is, and we rarely go out in summers and sunlight and all. So therefore, it is seen that majority of the world population is deficient in vitamin D. That is my point. So get it checked, and that is all related to the bone. So just telling you the applied aspect of it as well. So how to classify the bones? So according to shape, we have so many classifications. This first over here, we already have discussed the long bones. It has a shaft diaphysis with epiphysis. Then we have miniature short long bone. Okay, miniature short long bone, example, phalanges. You can see the fingers over here. Each finger, these 4 fingers, each finger will have 3 phalanx. A proximal, a middle, and a distal phalanx. So these phalanx, they only have one epiphysis. Then here modified long bones, some other modification where you don't have a medullary cavity. Then we have short bones like the carpals over here. The 8 carpals over here, they are classified into short bones. Then we have flat bones like, let me give an example over here. You will see they are flat bone like, for example, sternum. In front of the chest, we have the sternum bone, flat bone. Irregular bones which don't have a definite shape, they are formed by a combination of multiple bones. For example, the hip bone over here, we have the ilium, ischium, and pubis, as you will go now. Again, while discussing general anatomy, I mean, obviously won't be going into details of it, obviously, because once you enter into the topics of upper limb, lower limb, upper on abdomen, thorax, and others, these things will be dealt in detail. So ilium, ischium, pubis, they form the hip bone. Then we have pneumatic bones, which have air spaces inside. This is basically found more in birds. Right? Birds are very light in weight because they have to fly. So their bones inside have air cavities. Similarly, in humans also, few of our bones have multiple air cavities inside. And these bones over here are basically the facial bones. Basically, which bones? Facial bones. So a face may look very huge, very big, but its weight is not that much. If you go to your anatomy department, you go to the bone section, you show a skull, right? And if your college, if your department has original skull and they also have artificial skulls, which are made, human made, then you pick both of them, you will feel the natural skull is much lighter in weight compared to the one which are made, man-made models. Why? Because you can't even, obviously you can, but it is very difficult to make a bone, then make cavity inside it. That's not the point now, because you are not able to see it from outside. The cavity is lying inside. So therefore they don't make cavities normally. Then we have sesamoid bones. Sesamoid bones are actually some tendons they rub against. Suppose these are the tendons over here. Okay. They rub against a joint over here or a bone over here. such that few bones may develop in the line of the tendon only with this brown color. Okay, and these are known as what? These are known as sesamoid bones. These are known as sesamoid bones. Okay, so there are sesamoid bones also. Then accessory bones. Sometimes you have some small bones which are extra. They are known as accessory bones. So one classification of bone is this. But you will be uh, surprised or a bit excited to see that there are other classifications also. Like for example, one over here. Developmentally also the bones are classified into multiple other bones. Like what? Remember, at least must know things over here are membranous and cartilaginous bones at least. The majority ones, most of the bones are cartilaginous, some are membranous, simple as that. And tomorrow they ask you which cartilage over here are we talking of? Basically, we are talking of hyaline cartilage. So majority of our entire skeletal system, which we see in an adult, is formed or was once in our embryonic life a hyaline cartilage. So majority of the skeletal system is coming from hyaline cartilage. Only few of the bones are membranous in origin. Membranous meaning by, for example, again, the bones of the face, okay, a bit of clavicle, which is the collarbone, right? And in face, mandible is also included. Yeah, a few bones, not all entire facial bones, but a few bones in the face and the clavicle, they are membranous. The rest, most of the bones in our body are cartilaginous. Simple, remember that. Then there comes a regional classification, region-wise, how to divide. Now we all know that what is axial and appendicular skeleton. Okay, some students take the other way of learning that they start to cram axial skeleton. Okay, this is coming in the axial skeleton. I would always advise not to rush. Okay, not to rush into any topic. Suppose any term is coming like this, axial skeleton. Think who would have given the name axial skeleton and why? Because these bones are lying in the axis of the body. What does it mean? It means simply, again, there's a head and neck, okay, and there's this trunk part, right? Then there are these lower limb over here, okay, and you have the upper limb as well over here. You have the upper limb as well over here. Now, therefore, obviously, the axis is this thing only, right? This is the axis of the body. This is the axis of the body, right? Therefore, these bones are known as axial skeleton bones. And apart from this, you can see these are the four appendages of our body. Two upper limb, two lower limb. Therefore, the bones which are forming the upper and lower limb, they will fall under which category? They fall under appendicular. So therefore, these are the appendicular. So remember, appendicular skeleton includes bone of the limb. Therefore, limbs are known as appendages. Appendages, appendicular skeleton, keep it simple, don't complicate. Apart from the limbs, upper and lower limb, but the entire skeleton over here, this all will come under axial skeleton. So we have the skull, we have the vertebrae, we have the thoracic cage, which includes obviously the 12 pair of ribs over here. Is that clear? Now here lies the confusion. I would like to clarify here only so that things are clarified. Now the bones which are joining the axial to the appendicular skeleton. Now there are few bones over here. Like for example, we are discussing, no, there's a scapula bone behind, there's a clavicle in front, then there is hip bone over here. So if these clavicle, scapula, hip bone are actually between the axial and appendicular skeleton. So anatomically, we would put them under which category is a question. Therefore, I want to clarify that the bones of the clavicle and scapula, which are known as shoulder girdle bones. What are they known as? Shoulder girdle. And a pair of hip bones which form the whole pelvis, they are known as our pelvic girdle over here. Now these girdles over here, they actually fall under the appendicular skeleton. They are not the part of axial skeleton. Because else things will keep on being complicated. These girdle bones or girdle skeleton, they come under appendicular bones, simple as that. There shouldn't be any confusion. Moving ahead, we have structural classification. Again, how they are formed, compact and cancellous. So again, the word itself is self justifying or explaining that compact is a bone, is dense, texture is ivory, extremely porous, but extremely porous, because porous doesn't go well with the compact. Again, if you go to the bone section of the anatomy department, and if luckily you have both the natural and the artificial skeleton over there, then initially I talked to you about picking up the skull. You'll feel the difference in weight. Similarly, you pick up any other bone, say femur, you have picked up both a normal natural skeleton and a artificial one. You will again feel the difference between the weight. The normal or the natural, normal, I mean by normal, I mean natural. The natural bone will be very hard, but it is not that heavy. With your life experience, the moment you see such a long bone like a femur, and you pick it up and you just see how strong it is, then you realize, but it is not that heavy. The reason is because it is extremely porous. It has a medullary cavity inside, okay, like a bone marrow inside, and it is highly porous. That's the whole point. And cancellous is a trabecular spongy bone, which are basically found at the we can say the ends of long bones are where we normally see the this cancellous. Okay. Then there comes a microscopically is this difference over here. Okay. Blood supply we'll discuss later on. The blood supply is not the point that we discuss right now. Just give me a second. Okay. Now we're coming to the joints part. Okay. So what are the different types of joints over here? Let us see that. Right. So different types of joints. And what about joints? Till now we have discussed what? We basically discussed that, okay, epiphysis and basically about the classification of bones. So bones epiphysis is what we have discussed in the first half of our lecture. Okay, now we'll come to the specific types of joints and we'll end up with the nerve over here, basic how the spinal nerve, the nervous system basic over here. The joints is quite an interesting topic and quite an important topic. How are you going to classify the joints? Joints we all know, where two or more than two bones, are aligned to each other, that is known as joint. It could be two bones. Normally there are two bones, but at places there can be more than two bones, like area on the wrist, the knee joint. Okay. So these areas, they have more than two bones. So they are known as more than two bones, but they are joints only. So there are three types of joints which one should basically know. What are these three types? Are the ones which are shown on your screen right now. One is a fibrous variety of joint. One is the cartilaginous variety of joint. And finally, one is a synovial variety of joint. There are three varieties, three main varieties of joints, which should be at the tip of your tongue when any question or any viva question or any theory question comes for the part of joint. To put in a more easily understandable thing, majority of our joints are synovial. They are mobile joints. So you can see, if you just imagine a person coming towards you or walking here and there, you are seeing a person who is mobile. You'll see that the majority of the body is moving. It is only possible through the mobile joints. If the joints are stiff, the body won't move. So majority of the joints in the body are mobile. Then after this, we have two other joints, fibrous and cartilaginous. Fibrous joints are actually immobile. They don't move at all. Like you'll see the face turning here and there, but you won't see the individual, or you won't see the parts of the skull moving separately than other. So the sutures in the skull bone, they are a variety of fibrous joint. Okay, sutures over here. Syndesmosis. Again, it is between the two bones like radius and ulna. We have interosseous membrane between them, and your tooth and socket known as gomphosis. So these are not moving at all. So they are known as fibrous joint. I would also like to tell you over here that how are they named, because that should be the thing which should come to your mind by now. Okay, we are naming them on what basis? Who coined these terms? So there has to be some meaning, no? And why should one be curious about the meaning of that particular word? So, see, you're reading the topic, you should know. Second thing is, it will help you in understanding the topic if you know that, okay, this was given this name, why? Is there any logic behind it? Okay, so many times the names of anything gives you a huge benefit. So fibrous joint, cartilaginous joint, and synovial joint are named because in a fibrous joint, between the two bones, you have a structure that is mainly fibrous or made up of fibrocartilage. In cartilaginous joint, between two bones, you will have cartilage, like a hyaline cartilage, but you will also have a disc made up of white fibrocartilage. Therefore, cartilaginous joints are partially mobile. Not all, but few. We'll see their ultimate difference as well. Because cartilaginous joints are again divided into primary and secondary cartilaginous. Okay, primary and secondary cartilaginous. The primary cartilaginous joint is actually sort of, I would say, sort of misnomer because they are only, as we discuss in development of bone, know that in the initial part we have the epiphysis, then we have the diaphysis, and we have the epiphysis. And between these, we have what? We had this growing area known as metaphysis that was actually cartilage. So now, if you see at this image, you will might argue that, okay, so but so there's a cartilage between two bones. So is it a joint? The answer is yes. Anatomically and technically, this single bone, before it fuses, is having two joints inside the bone only. Because now it is still increasing in length, no? So this type of joint is known as primary cartilaginous joint or synchondrosis, as written temporary in nature. So once this particular human body attains its full height, this cartilage would be replaced by the bone, right? So it is a temporary in nature. It is known as synchondrosis. And therefore it is converted into bone later, so we call it as synostosis. Simple as that. And next we have a primary, after primary, we have a secondary cartilaginous joint, which are permanent, persist throughout life. They are partially mobile. So think about area. I told you synovial joint, they are mobile. Then I said fibrous joint, they are not mobile. Examples I gave you like synovial, upper limb, lower limb joints, they are mobile. Fibrous joint, I gave you an example like the suture between your skull bones, like frontal parietal. Between these bones, we have a sutures, a tooth socket. Third category over here is cartilaginous, in which I told you, okay, primary cartilaginous is a temporary joint. Okay, I gave you an example, synchondrosis. But secondary cartilaginous is partially mobile. Now, if you are listening to this lecture, then and you are in the beginning of your MBBS career, then you should think, which part of the body is left now, which is not entirely mobile and which is not entirely fused. Think about it. We have dealt with upper lower limbs separately. We have seen the sutures in the skull. Now, what is left is our exoskeleton, vertebral bodies, and thoracic cage, all those things. So yes, between the vertebral bodies, between the ribs and the sternum, few areas over here, between the sternum only, we have areas which are partially mobile. Secondary cartilaginous. They are known as symphysis, like pubic symphysis. Then joint between vertebral bodies, between the sternum only. We have between the manubrium and the body of sternum, or between body and the xiphoid part of sternum. We have secondary cartilaginous. Okay. Then synovial, as I told you, is most evolved, most mobile. So humans are mobile due to this only. So these three terms which one should know clearly as well. This actually joint is the most important subtopic or topic in general anatomy, considering your multiple choice questions, right? Joint is very, very important. Okay, now these are all the various types of the synovial joints, depending on the shape of the bones. They are ball and socket. I will tell you its classification separately. Then there's saddle, bicondyle, ellipsoid, hinge, pivot, shoulder, and plane. Fine. I'll show you how to remember this, right? So functional classification is this that you already have seen, that they are freely mobile. So which joint is this? Diarthrosis, which one? It is synovial. Then they are immobile synarthrosis. This is which one? You remember they are fibrous. And slightly mobile is amphiarthrosis. Which one? It is secondary cartilaginous. Simple as that. So question might come. Synarthrosis, amphi, and diarthrosis. Do remember? So how to remember it? Syn means fused. Syn means fused. Syn. Okay, syn means fused. So if synarthrosis means the joints are fused, so they won't move. Di means they are separate, so they are freely mobile. Amphi means amphibians, can live both in water and land, so they are partially. You can remember it by that. So synarthrosis, fused, fibrous. F for fused, F for fibrous. Diarthrosis, separate, mobile, fully mobile, synovial. Synovial joint actually has a synovial cavity between them. So they are fully mobile, and amphi is between them. Okay, just we'll go through the slides and I'll show you something other. Okay, then there are different classifications, fine. But yeah, before moving to all of this, let me show you some slides over here where you can understand some things more in a better manner. Okay, in this image, what has been shown to you is a fibrous joint. As you can see, between bones, we have fibrous tissue. Then you are seeing a primary cartilaginous joint where you have this whole cartilage between the bones, and you have a secondary cartilaginous joint where apart from hyaline cartilage, you have a fibrocartilage. The examples you know by now. Now, what I was going to tell you is about the basic anatomy of synovial joint. Majority of the joints in our body, majority are synovial. So how is the synovial joint moving? That is very important. One should know it. So let us give a couple of minutes to the basic anatomy of synovial. Then I will simply tell you its classification. So imagine these are the two ends of bone. One bone is above going like this, one bone is below coming like this. Now, both of these ends of bone over here, which are going to form the synovial joint, because these bones are actually going to rub against each other. So they are provided by a protective hyaline cartilage over here. So cartilage is protecting the ends of the long bone over here. This is cartilage. This is what this is? A hyaline cartilage, a tough hyaline cartilage covering the ends. Then what we also will have over here a synovial membrane. What we have over here, we will have a synovial membrane. So this will be the synovial membrane. What is this synovial membrane going to do? It is going to secrete the synovial fluid over here. So it is not that full space is filled, but yeah, it is hardly even less than 1 ml of fluid. This just to form a separate layer between the two rubbing surfaces. Suppose you are rubbing your hands like this. If there is some water in between or there's some oil in between, then your hands can easily rub. I hope you can correlate. So that layer of oil is like a synovial fluid, which is secreted by the synovial membrane. So the synovial membrane is making the synovial fluid, which is between these two bones, which are already covered by the cartilage over here. Okay. Now this whole system over here of joint will be covered by over here by a capsule outside. Why? Because you don't want the synovial membrane to easily get injured, else the fluid will start to come out and the whole joint will be demolished. So there's entire capsule which is covering the joint over here. And now see bone number A and bone number B over here, they will be moving against each other. Okay, and the movement will come into play, and this is how the body actually moves. Right, but now you might argue, but sir, how can the capsule hold that much? Therefore, apart from all of this, we have various ligaments which are attached from bone A to bone B in different directions. Then we have muscles and their tendons also, which are passing around the joints to support them. Like you will learn the rotator cuff in the shoulder area. You have ligaments, multiple ligaments. Let me give you some example. Like in hip joint, we have iliofemoral, ischiofemoral, pubofemoral ligament. In shoulder joint, we have glenohumeral ligament, coracohumeral. So many ligaments are there to protect the joint. Okay. In knee joint also, we have so many ligaments. But a basic anatomy of a synovial joint will be this articulating, this is known as articular disc over here, or not disc, but yeah, articular cartilage over here. It is known as articular cartilage. Which cartilage it is? It is again hyaline cartilage. That is one characteristic feature. Second is synovial membrane. Third is this fluid which is secreted by the membrane. Fourth is the capsule. And fifth and sixth, you can say the ligaments, muscles, and tendons which are supporting the joints. Because these joints are mobile, so a thing which is more mobile is more prone to damage. That we also understand. This is the basic anatomy of synovial joint. Fibrous cartilaginous you already have seen over here. Then how to classify the synovial joints? That is also give us a couple of minutes over here. So synovial joints are mobile joints. Okay. So there are different ways to classify them, but the most you can say most essential and most easy and most practical and most useful classification is the one which I'm going to tell you. So when a particular joint is mobile, every joint is mobile up to a certain degree that your elbow can move this much only, your knees can move that much only, your shoulder can move much higher, your fingers can move this much only. So every joint has a limited mobility. Okay. So therefore, we have axis of movement or axis of movement in a synovial joints. First classification, we can say that there's no axis. So their joint is not moving in any axis. So what is the joint doing? It is simply gliding against each other. Like I told you, the hands. Simply gliding. Not that much of gliding, but a bit of gliding over here, simple as that. Then second classification will be uniaxial, that the movement is in one particular axis on. So which example? Think. If you are seeing this video later on also, and at least pause and think. If you have not no, you don't know the answer, but try to think. A joint moving only in one axis. This movement, elbow, it can't go like this. This movement is actually at the shoulder, but in the elbow only this movement is permitted. Flexion extension, flexion extension. What is the axis? The transverse axis is the axis. Okay, so it is known as uniaxial. Here, two varieties will come. These two varieties will be what? Will be a pivot joint, like rotation, and will be this will be your hinge joint. Pivot and hinge joint. Hinge, as I told you, the example of elbow. Pivot is rotation. So it is moving in a vertical axis. This is uniaxial joint. The third classification will be biaxial. So more than one axis, biaxial. Like our knee joint flexion, apart from flexion extension, there's a bit of rotation in the knee joint. So they are known as condylar joint because knee is formed by condyles. Okay, and then there is example of say ellipsoid joint. Ellipsoid is like wrist. Wrist, you can see this movement also, this movement also. Okay. Examples I'll tell you. Then fourth one is the multi-axial joint. Joint is moving in multiple axes. One I am sure all of us must be knowing is the ball and socket. This is the ball and socket. Here you have a ball shaped structure at one bone and a socket shaped structure at the other bone. So that ball fits into the socket. And the ball can easily move here and there and taking the whole bone along with it. Example, shoulder and hip joint. The other example over here will be the saddle variety. What is the saddle over here? Saddle again. Example, let me tell you, is this first carpo-metacarpal joint, by which the thumb can be moved in many directions. If you compare the movement of thumb with other fingers, you will realize the movement of thumb is in more directions or more axes than the movement of other fingers. So saddle variety, we can give an example like first carpo-metacarpal. Now examples, let me give over here that you have a good picture. Then I'll show you images also, don't worry. So gliding, we can say intercarpal joints or intertarsal joints. Pivot, as I told, that atlantoaxial. So it is known as median atlantoaxial. What is the movement? This is the movement. Axis is vertical axis. So median when we say atlantoaxial, atlanto is first vertebrae and axis is second vertebrae. Hinge joint, I told you, elbow, okay, ankle, these are hinge joints. Condylar, like a temporomandibular joint, this mandible and temporal bone. Bicondylar, you can say knee joint. Ellipsoid wrist joint is a good example. Ball and socket, as I told, we have shoulder and hip joint. We have shoulder and we have hip joint. Saddle, as I told, first carpo-metacarpal joint. And just for your knowledge, see, we are not discussing the entire example. Why? Because this is general anatomy. The moment you come into the core anatomy things, they will be discussed again. Saddle, and the example is a sternoclavicular joint between the sternum and the clavicle. This joint over here. This is again example of saddle variety. We have this basic knowledge. I will again ask you to just pause it, take a screenshot and write it on your own notes, the manner which you are more comfortable with. You understand it better. Then let us see some images over here as well. Okay, now these are a few images. This is syndesmosis over here. Syndesmosis. Remember, it was which variety of joint? Interosseous membrane, as comes in short question also. It was fibrous variety. Okay, here you can see again hip bones. We have the moment hip bones, they articulate with the sacrum. They are known as sacroiliac joint. They both have syndesmosis, that is fibrous, and also a bit of synovial variety inside. Because the joint is a huge joint. Then as we move forward, the gomphosis again, F for fibrous. Okay. This is a type of suture only, but it has been given a different name. So it is a fibrous joint, no doubt about it. F for fibrous joint, but it has been given a different name of spondylosis. It is between the sphenoid bone and the vomer. It is between the sphenoid bone and vomer. It is a shape of a ridge and groove. You can see the ridge of the sphenoid is fitting into the groove of the vomer. Vomer is that bone, no, that forms the nasal septum. It is given a different name. Remember, this name might be asked sometimes, spondylosis. This is a rib cage. You can see we have a secondary cartilaginous joint over here. This is known as manubriosternal joint. And we have a primary cartilage also between the rib and the cartilage. So these are the cartilages over here. And the secondary cartilaginous, again, as I told you, partially mobile between the vertebral bodies. So it is known as intervertebral disc. They are example of secondary cartilages. I explained you in detail how the synovial joint is formed. Now see some examples. Sternoclavicular. Now these are all the examples of synovial. Which variety of synovial? Saddle. Acromioclavicular. This is again a plain variety of again, but they're all synovial only. Next example, again synovial. Atlas axis, which joint? Pivot joint. Comes under uniaxial. One axis only. Again pivot joint. Okay, it is between your head of the radius over here. Or you can say the radioulnar. Radioulnar. It is not an elbow joint which is pivot. Elbow is hinge joint. This radioulnar joint is pivot joint, where you can do the supination and pronation movement. This rotation movement is only at one axis. Hinge joint again between your fingers. Of these between the fingers, only this movement is possible. So it is uniaxial. All of these again I'm explaining. As I'm writing S over here is synovial. Then over here we have this metacarpal and phalanx. So this joint over here is again a variety of condyloid or condylar joint. Because you can see this movement, flexion, extension, and a bit of adduction, abduction is also possible. In the foot bone also we have miniature sort, but yeah, we have two multi-axial joints in one diagram. Ball and socket and saddle joint. This ball and socket is between talus bone over here and navicular bone over here. The saddle is between calcaneum bone over here and cuboid bone over here. Remember, they are sometimes asked as a MCQ. You should know. I told you the movement of thumb over here. This is the first finger, that is a thumb over here, is quite bigger compared to the movement of other fingers. Why? Because of this joint. Let me put an arrow, and this is actually asked in recent your FMG or your NEET PG exam also. This joint over here. As I said that we have first CMC, carpo metacarpal. It is not your CMC Medical College, Christian Medical College. No, it is not SAT CMC. CMC is carpo metacarpal. First CMC is your saddle, comes under saddle variety of synovial joint. The question might have been come that which carpal it is. So carpal is your trapezium. This was the carpal and this is the metacarpal of the thumb, or it is the first metacarpal. Okay. Then hip bone femur, you can already see it is a hip joint. So which variety of joint it is? Ball and socket. It is a ball and socket variety. Okay, so these are the various types of joint that one should be very clear with. Okay, spinal nerve is a topic that we'll take later on. But yeah, coming back over here, let me come back to these slides, which I discussed them in the beginning. So spinal nerves, don't worry about the spinal nerve. We will discuss it again in some other lecture. That will again come in the whole nervous system. But understand the bones and the joints and the sesamoid bone types of joint, they are very, very important part of general anatomy. Okay. Again, coming to all of these things. So again, as I told in the beginning, that will again refresh all of this. So these are the benefits of Auricle. As you can see in this particular slide, recorded classes, name is self-explanatory. Live classes, the one, if you are attending it live, then it is like this. And all of this are in your app. I would urge you, all of you, to download the app also. Download the app also and experience it. The more you experience, the more you become used to it. And we have the exam modules. That is actually a sort of quick revision module. And we have this doubt clearing session, hard copy. I'm telling you this because all the pages are not shown in this particular image, nor is it actually easy to show inside the books. But yeah, these books are fantastically created. Beautiful images, fun to learn. Why? Because they are multiple labeled to be done, match the following diagrams, and all the notes are in a question answer format. So it doesn't mean that there is no theory. Yes, theory is there obviously, but to begin with, it's the format of a question answer that you understand it better. A question bank also is there. Practical sessions, very, very important. Course of our medical is like this, not just anatomy subject, but entire medical is incomplete without having practical knowledge. For example, just to tell you, you will encounter with a subject known as medicine later on in your MBBS career. Some of you, or most of you, must be knowing it also. Medicine, you have fantastic books. One of the most known as the Bible of medicine is the Harrison textbook, and that is actually the epitome of the medicine for MBBS. But if you keep on reading only Harrison, if you don't see the patients and you don't know how to take the history or examine the patient, then what will Harrison do? And if you're only examining the patient, only seeing the patient, not reading the book, then what is the difference between you and a quack, if I may say so? Therefore, both things come hand in hand. Similarly, anatomy without practical sessions is nothing. I keep on telling you all of these bones and all, but yeah, when you will have practical sessions, you'll be shown different bones, how they are moving, and so on and so forth, all other things. Therefore, practical sessions, that is important. Again, these are subscription plans. I will urge all of you to take the screenshot of them and just go through them. Right? That's all. I hope you enjoyed. Thanks for watching, and you can follow all these social media handles and use the mobile phone and the internet carefully, right? And use them judiciously. And if it is only benefiting you, don't waste your time there too much. That would be my last advice for the day. That's all. Good night. See you soon. Bye-bye.